Males need hormone replacement. Absolutely. All of us are getting older. Men get older. And as men get older, we begin to lose our testosterone production. All men will lose their production. And what happens? Well, men begin to get more frail. They begin to lose the muscle mass that they used to have. They find that their mental focus, their activity levels begin to go down. Andropause is the male form of menopause. Menopause happens to women, all women. Andropause happens to all men too, just men seem to not choose to admit it. Women are okay with the fact that they're going to go through menopause, but men seem to hold out that nope, they're the only ones on the planet that are going to make it from age 14 to 85 and not go through that decline. They're going to. Fall asleep after dinner? Probably suffering from andropause. Getting belly fat? Might be a little bit of andropause. These are some of the symptoms you see in men as they get older and they lose their testosterone level. So when a guy was younger, he was all lean, fit. If he actually wanted to lose some fat, he did. He could just burn it off. But now he's 60 years old or 50 years old and he's starting to get chubby and he's not got the energy that he used to have. He might not even have the desire that he used to have. He begins to lose interest in being intimate. He might even be able to lose the ability to perform some of the intimate actions that he did in the past, or at least to the degree that he'd like. Well, all of these are probably related to a lack of hormones. And men are pretty simple. It's almost always a lack of testosterone. Now, it's important that a man sees a physician that's understanding male hormones. There are other things besides just testosterone, and that's very, very important. Men have estrogen in them, and some men have too much estrogen. In fact, the majority of men who are 65 years old actually have more estrogen in them than if their wife is 65. And many other physicians just aren't used to this fact. But somebody like myself, I'm a urologist, from 30 years ago. I've dealt with men's health for decades, and I understand that there are different things besides just testosterone. And so at Biltmore Restorative Medicine, a man's going to feel comfortable having an all-encompassing approach to his health, particularly his hormonal health. So we're going to evaluate your testosterone levels. I'm going to look at other things like your estrogen and sex hormone binding globulin and things that might not mean anything to you right now, but after a visit with me, you're going to understand why these things are important. It's not just here is a testosterone prescription or put this cream on, you'll be fine. There's many other factors that men need to look into. And there's some issues that men have to worry about as far as increasing red blood cell counts or what's going to happen to the prostate. All of this can be dealt with very safely if your physician understands what's going to go on, what to look for, what to manage. So, we have a very vibrant male practice at Biltmore Restorative Medicine. I think a lot of that has to do with the fact that I'm a urologist and men feel comfortable with knowing that I know men's health inside and out. Men call up and they ask, what should my testosterone number be? That question has no good answer. Everybody's different. Everybody's different. Some men don't feel comfortable at the exact same level that the next guy feels uncomfortable. Some men need a very high number. They're not going to feel good unless it's way up there. Some men, that makes them too aggressive, mean. They feel better at a lower number. So when people are asking, what's my number supposed to be? You need a doctor who understands testosterone replacement and how to talk to a patient to come up with what's right. And here's the big thing. It might not be right day one. It has to be adjusted. There's no such thing as here is the dose. Now go out and be like everybody else. You need a physician that's going to monitor, ask you the right questions, and tailor the dose to what works specifically for the individual patient. Everybody's different. Everybody's different. So don't let your provider tell you that your number is fine. If you're not feeling what you think you should be feeling and it has to do with low testosterone symptoms, that number's not good for you. Everybody's different, and what's good for you might not be good for the next guy. So just choose your provider carefully. Choose somebody who understands men's health. That's the most important thing.